There is now a breakthrough treatment available for those living with a form of brain cancer, IDH mutant glioma. So let's welcome Dr. Katie Peters, Professor of Neurology and Neurosurgery at the Preston Robert Tisch Brain Tumor Center at Duke University, and Rachel, a patient living with IDH mutant gliomas. Thank you both so much for joining us today.
Thanks for having us.
Thank you so much, Jordan.
Of course. So doctor, let's start with you. What exactly is glioma, and more specifically IDH mutant glioma?
Yes, so glioma is a primary brain tumor. That means it only exists in the brain. The glioma is the most common type of malignant primary brain tumor that usually affects patients in the age of like 30 to 40, so really in the middle of their life. What we know is that this tumor can harbor a mutation in the tumor itself called isocitrate dehydrogenase, which is also known as IDH. And we know that this is the mutation that actually causes the tumor to grow and develop. So what's amazing about this new breakthrough drug, Voranigo, is it actually specifically targets that mutation and shuts down the tumor.
That's amazing. Rachel, can you tell us a little bit about your symptoms and your diagnosis overall?
Sure, I was at work one day and all of a sudden I felt all this weird deja vu, and for no reason. And I started to kind of lose track of when my birthday was and where was I and all that. So I took myself to the hospital, and after about 2 months of MRIs and working with my neurologist, he diagnosed me with a brain tumor, which was obviously very, very scary. So I went and I had surgery, and after the surgery they did a biopsy and they realized I had this particular kind of IDH mutant tumor.
That's so interesting. And thank you for telling us the symptoms too, because I think if somebody else is hearing this and they're like, oh my gosh, I've dealt with that, that could maybe help a lot of people. So go and see your doctor, of course, if you have any issues or thoughts that you might have some of those symptoms, of course. I'm talking to our viewers right now. But doctor, tell us more about the FDA approval of Voranigo and what it means for those living with grade 2 IDH mutant glioma.
So Jordan, this was really a pivotal groundbreaking phase 3 clinical trial that looked at Voranigo in patients that had low grade, grade 2 gliomas. And they had to have enough tumor that we could actually see whether the drug could actually suppress the growth and even shrink it. So when this trial was successful, it actually showed that it improved progression-free survival in patients and also delayed the time to next intervention, which means for patients who would normally have this kind of tumor, they may have to have radiation, more surgery, maybe even serious chemotherapy. And what Voranigo did is it allows them to delay that significantly. So that's really the most important touch point for this drug and for this FDA approval. You can actually check out more information about the drug at voranigo.com, and it really goes into all the risks and benefits of the drug itself and also goes over more about that clinical trial.
Wonderful. And Rachel, let's go back to you because I would like to hear a little bit about your treatment journey.
Sure. So first I was on what's called watch and wait, where they just make sure that everything's quiet, as I call it. And after about a year or so, things started to wake up a little bit. And so they asked if I wanted to go on the Indigo trial, which is a triple-blind trial. So I didn't know if I was on the meds. My doctor didn't know if I was on the meds. And after about 2.5 years of stability, all of a sudden it started sort of waking up again. So they unblinded me, and we realized I had been on the placebo. So they moved me onto the drug, and I've been on the drug now about a 1.5 years, and my tumor is completely quiet. So I'm able to live, you know, a full life without worrying about things growing. So the drug really works.
Oh my gosh, that's absolutely amazing. I'm so glad to hear that. Doctor, where can we go again for more information on this? Because I think this could help a lot of people.
Absolutely. So you can check out the website voranigo.com. That's where you can learn more about the benefits and risks of the medication, along with really all the specifics of the Indigo study.
Awesome. Thank you again both for joining us today. And Rachel, I'm glad to hear you're doing well.
Thank you so much.
Thank you, Jordan.
Yes, you're so welcome. And everyone at home, if you'd like to see this interview again, just head to First Coast News Plus.